This is more information on how posture can affect the quality of your mental state and your way of thinking. Our mind and the experiences within it is a collection of initiating and responses that occur inside of the brain. So this is the brain. In order for the brain to work appropriately, we have what are called blood cells, which carry oxygen. As blood cells enter the brain, synapses occur between information points. Otherwise known as neurons. So when these points are firing on and off, they can create a sequence which in turn relays information either from the receiving end of the body or the acting part of the body. But what happens when these synapses or these on and off switches become constantly on as a result of not having enough oxygen in the brain, which then leads to the brain having to work harder to perform seemingly simple tasks. So the brain needs oxygen. So what? Well, a human body, now we're going to look at it from the front. Yeah. Has a rib cage in front of the spine. This rib cage goes from the front of the body to the back, attaching in between the vertebrae. And what they do is, as we breathe in and out, they go up or away from each other. And as we exhale, if they're functioning properly, then they would return to a resting state. So as we're looking at these diagrams, this posture is obviously it's very open, very neutral, and what is known as open packed. So the joints can move freely, and it has the least amount of restriction in how the joints are moving with one another. In a different video, I showed how a human body can, how the human body can start to lean towards the things that we're looking at. And then force our neck to move forwards, our back to hunch over, and then the low back to be hyperextended or too far bent. This is an extreme example just so it's visible. The human body can also have different ways that gravity and life experiences can affect it. So the human body can then also be hyperkyphotic, so that curve in the thorax or the upper back is very exaggerated, which then creates a specific point in base of the skull, so a compression because of the increase in the angle. And then in some cases it actually decreases. So this one is it's shortening the angle, the distance between 2 points. This one is lengthening the angle, so decreasing it, or lengthening the distance between those 2 points. Just legs. Okay, so this person would have then their ribs almost facing the way that this this person's head is facing, and then creating all sorts of difficulties there. So in this person's ribs, even though their neck and their lower back and some of their upper back become very compromised, for the most part, the ribs are more free and the organs are more free. However, there's still the impingement point here that can happen, which can reduce the blood flow to the brain. But when the posture imbalance is happening at the upper back, what happens to these ribs is, because they don't really have anywhere to go, is they compress, and as a result also compress the organs. So the biggest thing that I want to point out with this compression isn't necessarily the digestive organs specifically, but more, this one doesn't work. The lungs. It compresses the lungs. So in this body, if the left lung looks something like this, because of the heart, heart's like over here somewhere. So the left lung looks like that in neutral position. In this kyphotic position, the left lung is significantly compressed, and the main breathing muscle, which is the diaphragm over here, has nowhere to move. So it's almost like in normal situations where the ribs are kind of like this, the diaphragm would move diagonally outwards, so like this. Moves diagonally out, and then it almost kind of draws the lungs, so it's kind of like filling up a bag, like that. But when it's compressed like this, so we're going to take this angle that's slightly open and we're going to compress it. Then that diagonal outward movement can't occur because the movement goes directly into the organs, so it's already like compressed. So in action, this is what it would look like. Upright, normal, or healthy. Upright and healthy. And breathing with my diaphragm. Exhaling to relax. So if I was to compress my ribs, by changing my posture. It's both audible and visible that my body has to almost basically expand from the back outwards just to get any sort of movement in my lungs. So this is a picture of the lungs with the diaphragm lining, and then let's say the arteries to the brain. Most people, unless they're babies or laying on their back, sometimes even laying on their back, most people are what can be identified as apical breathers. Apical breathing means to breathe at the apex of the lungs. So this is where we would see the movement of in breathing. With apical breathing, the lungs have a chance to expand about that much because of the restriction of the rib cage. So then we get, as you can see, maybe 30% capacity of the lungs from apical breathing. So if most people are already breathing in a way that technically only use up about 30% of their lung capacity, that already puts the brain at only roughly 30% capacity as well, because the quality and the amount of oxygen in the blood cells per heartbeat that circulate to the brain is not at 100%. So the reason earlier why I said baby breathers, or babies that are breathing specifically, would not necessarily breathe only from the apex of their lungs. They do what we have observed as belly breathing. So naturally, the diaphragm is the main breathing muscle. As I mentioned earlier, it's meant to, as it contracts, it's meant to expand diagonally and away from the body, or so downwards and away from the body, all the way around the rib cage. So this is the sternum. This is where the ribs meet. Ow. The diaphragm lines the entire rib cage from front to back all the way around. So when we use the diaphragm for breathing, what happens is that the lungs actually expand to fill the entire rib cage or the thoracic cavity. So if before we were able to expand it by 30%, going by this diagram here, it looks like we've roughly added about 60 to 40% or 60 to 70% more volume intake to the lungs, which in turn translates to more apparent capacity for oxygen molecules to attach with the blood cells, red blood cells. Therefore, improving the amount of oxygenated red blood cells moving towards the brain.